David, when we met, described a tumultuous life of cycling from a male role to a female role internally. This had been his pattern all of his life. He was very socially isolated, pretty much just went to work, didn't really have any friends. I played the first recording and I hadn't listened back to it for 3 months. And out came this big, deep, booming, rumbly voice. And then we played back the recording we'd made that day, and here was this higher, lighter, very, very different voice that was now quite androgynous.
A patient that I treated in the Netherlands many years ago. He was nil by mouth, so he had a back tube. He was artificially fed after a brainstem stroke, and we started therapy in June. With hard work and exercises, we got this guy up to the fact that beginning of December, half December, he was cleared to eat everything, and he had a good recovery of all his total swallowing function.
John's a 65-year-old retired gentleman. He lived alone, and unfortunately he was diagnosed with laryngeal cancer, so cancer within the voice box. Because his voice box was removed, he could no longer produce voice like the general population can. The turning point for John was when he learnt how to block off his airway, the hole created here, with a laryngectomy on his neck, and diverted the air through into his swallowing tube, and he could create some noise himself that was his. Very throaty sounding, but still his.
A 20-year-old male, and the main concern that Mum and him had was about his social communication skills. He's had a diagnosis of ASD from when he was 3.5 years old. He's definitely made improvements in some of the structured conversational goals that we've worked on. So he can now initiate a conversation about an unfamiliar topic. He at least knows what questions to ask to prompt the information from the communication partner. So that was a little bit of an aha moment that I could see that insight in him developing.
We had a little girl with a severe profound hearing loss who was needing a cochlear implant. And in terms of speech and communication, she was presenting as any child would in terms of delayed speech and language associated with a late diagnosis of the hearing loss. The mum, who previously wasn't particularly strong on advocating for herself or her child, became a strong advocator.